Hey chicks, it's Craig Rubinstein here, and we've got a really good, interesting topic for this evening. That's preparing for surgery, what to do before surgery, during surgery, and after surgery to get the best results. So these are big topics, and we're going to go through a lot of things. I believe we've got quite a few questions, so what I might do is kick off and start by a few of them. But what I'd really like to do is, before answering any questions, is give you a few of my thoughts. I think the best way to get the best results from surgery, as I tell all my patients, is it's the right person having the right surgery at the right time for the right reasons. And the best way to do this is to get the right surgeon who'll give you the right advice. And the analogy that I like to use is that if you select a really, really good captain of a ship, a good captain, he won't tolerate a bad ship. And conversely, a really, really good ship won't tolerate not a good captain. So if you choose a good captain, it's quite likely that he'll have a good ship. And what I mean by a good ship is good anaesthetists, good nurses, good assistants, good hospitals, and who'll do things properly. Now, it's difficult because these days on the internet, there are people who are terrific on social media and they have beautiful black and white Instagram photographs, but you don't know if they're any good or if they've just paid someone to come up with these beautiful pictures. You don't know if they're a good surgeon. You don't know if they're technically good. You don't know if they're ethical, decent. There are a lot of things you don't know. So it is difficult. And there are some ways that you can give yourself the best chance. One of them is go and see several people. Trust your instincts, but do your checking, do your homework. And the best way is obviously if you know of someone, sorry, tipped over my new tripod. The best way is if you know someone who's had surgery, and at cosmetic surgery for women, probably 60, 70, 80% of people who come to us have come by recommendation. Hello, Rachel. So, and it looks like Amber's joining us. Hey, Amber, nice to see you. Before I go through questions, so there are a few things that you should look for. Make sure that the surgeon who you see is fully qualified, so a plastic surgeon. The term cosmetic surgeon currently in Australia, it has no official recognition. So to become a plastic surgeon is, well, I guess it's probably 15 years of training, in my case over 20 years of experience and thousands, if not tens of thousands of cases. So you want to choose someone who's fully qualified, but you want them to be experienced in the surgery that you do. So there's no point going to someone who's a terrific hand surgeon or a terrific whatever it happens to be. You want to go to a surgeon who is specialised, qualified, experienced in your surgery and does lots of them. And in our practice here, we have 6 surgeons, all of who are super specialists, and all we do every day of our life is what we do. So in my case, it's breasts and tummies. I don't do anything else. That's all I do. Every single day I either consult, and if I'm looking a little bit tired at the moment, I apologise, but I've just had a day of consulting. I think I've seen about 15 people, and every single person is brand new. Every person's important, and it takes a lot of energy, but that it is. So the things that I'd be careful of is make sure that you choose the right surgeon, someone who you feel good about. If there are little suspicions, then it doesn't necessarily guarantee it, but they may not be the right person for you. Make sure that they've got good qualifications. It's also worth checking, are they a fly-in, fly-out surgeon? There are surgeons, some of them not even surgeons, but doctors. There are surgeons who go all around the country. And the question you've got to ask yourself is, if they're that good a surgeon, why do they fly around? Why aren't they just in one place? Similarly, even if they're in one state, they don't have to fly around. If they've got lots and lots of centres. So being in one centre is probably a good sign. Having been in practice a good long time is probably a good sign. Someone who, for example, has gone off and done something else, so went and do a business which may or may not have failed for 9 years, then they may not be the most appropriate person for you. So a person who does what they do, who's got a track record, who can show you hundreds if not thousands of photographs and who's got recommendations. So they're the things I'd be looking for. Again, make sure that they work in a proper hospital. They don't do surgery in their little back room, that they do it properly. Do it properly, proper hospital, proper nurses, proper doctors, proper anaesthetists. And if you do things properly, you're most likely to get the proper result. So I think we may have we've got some people joining. So I've got Trish. Hello, Trish. Hello, Amber. And Amber said exactly. One of my favourite breast and body plastic surgeons, obviously excluding Nick. Now, Amber is married to Nick, so it's not unreasonable that I'm a poor second to Nick, but we love Amber, we love Nick, and good surgeons, good people. So I've made a few notes of what else to look out for. What are they? Impersonal clinics. So if you go on and they don't even mention the surgeons, or they use the word doctor and they're not qualified surgeons, doesn't mean they're not good, but I'd be pretty careful. It's probably a good starting point to maybe consider elsewhere. And the other thing is that's the point is, if you go to an individual surgeon who works by themselves, then they're not going to have access to state-of-the-art technology. They're not going to be able to educate each other. So it's probably, I mean, it's self-serving because we are a group and we are very experienced and professional, but a group practice is more likely to be able to have someone who specialises in what you want to do. So they're all things I would look for. Now, I've been told by Rachel, who's been glaring at me, I'm not allowed to touch paper because apparently it rustles, but they're probably the main things. So do your homework, don't rush, don't be pressured. If any surgeon or any of their salespeople pressure you, it's probably a good sign that it's not the way to go. And Rachel's holding a sign up that says I'm supposed to relax. I think I relax in surgery, not necessarily when I'm being interviewed. Hello, Michelle. So now, in terms of questions, let me go through some questions. These have been sent to me, so I'll go through them, and I believe there'll be more questions. So the first one is, it says, I'm a very lean patient with implants who develops rippling. What action would you take and what causes rippling? Well, there are a number of causes of rippling, but probably the number one is wrong choice of implant. Now, the way I like to put it as an analogy, when someone comes to me for breast augmentation, there are a lot of things I need to take into consideration, but I like to use a building analogy. That if you have a building site, if we put a building that's wider than the foundations, it's going to cause mischief. If we go too small, we're wasting our resources. So what we want to do is work out the building that optimally fills that building site. Then if we want a bigger building, we can go 1 story, 2 story, 3 story, 4 story, which is low profile, moderate profile, high profile, ultra high profile. Now, if we put a little flat pancake bungalow, it might be a waste of time. A great big skyscraper might look like Pamela Anderson, tip you over, so we've got to customise it for you. But I've actually got a few implants here to demonstrate what I mean by the wrong size implant. So if I was, for example, to put this implant in, which is a temporary sizer, and that's an 800, then unless you were an East German shot putter who weighed, 15 stone or 150 kilos, you're going to get rippling and creasing. So that's not the right implant, and it's going to cause problems. So a very big implant, unless you've got a very big breast pocket, may not be appropriate. Whereas, just to state the obvious, putting a tiny little implant might not justify it, so we want to go in between. If we choose an implant that's got the wrong fuel, for example, saline or salt water, and again, these are all my opinions, a salt water implant, when they arrive, they're unfilled, so surgeons fill them. If you don't fill them enough, they're going to collapse. Too much, you can look like Tory Spelling, and they do tend to ripple and crease. So it's an obsolete technology, and almost nobody in Melbourne still uses them. There are very, very few people who use them, and they're significantly in the minority. So I'm not saying they don't have a role, but it's really an obsolete technology, and I think it just gives a poor result, and I wouldn't be recommending them except in very, very exceptional circumstances. So you want to go to a surgeon who'll offer you everything, who's not a zealot who says you've got to have this, you've got to have that. You don't got to have anything. You can have anything you want, and what a good surgeon will do is they'll give you the whole menu and then work together with you to decide what you want to have. So, for example, what would be, and there are other questions too, so what would decrease the rippling would be to have an implant that's got a slightly firmer gel, that's got more of a fill, and that's customised to fit you. And the other point too is if you're very, very lean, and if your ribs stick out, then the implant's going to stick out. So in that case, it'd be even more important not to go too big. So I'm sorry to sort of carry on a little bit, but these are all topics I can talk about for hours at a time. But again, the right implant put in the right way with the right filling is probably going to decrease your risk of rippling. Now what have we got here? We've got Sue. Hey Sue. Hi Craig, I have my abdominoplasty with you in 5 weeks today. After massive weight loss in a period of 6 months, I'd like to ask you if it makes any difference after surgery if I strengthen my... I need to touch this because I can't read it. I think it's going to say, it's cut off, but I think it says strengthen my abs. If that's what it says. Strengthening is always good. One of the problems with having had children is that they do tend to stretch and wreck everything, including the tummy muscles. So when some people do a tummy tuck, they just cut a little bit of skin and call it a tummy tuck. If you're going to do it properly, The way that we do it, the way I do a lot of liposuction. So I do liposuction to the upper tummy to smooth that out. I do liposuction down south so you don't get a bulge, and repair the muscle. So if your muscles have been split, which if you've had 2 or more children or twins, then you can't correct them by themselves. But as a surgeon, I can put them back in place and then you can strengthen them, so it's the best of both worlds. I hope that answers your question, Sue, and I think I'll be seeing you very soon, which is always pleasurable, and we can go through that in a little bit more detail. From Crystal, after a consultation with a patient, if they book in for a date, say 2 months ahead, do you put them on a diet of vitamin supplements so they can be in optimum health before they have their surgery? What I like to tell people is, if what you're doing is what you do, keep doing it. And the worst thing is to suddenly go and do something differently. And when I was a very, very junior trainee, when we learnt on microsurgery and similar reconstruction, which is what good cosmetic surgeons start off as, or cosmetic plastic surgeons, we do reconstructive so we know what's going on. It used to be said that if you're going to do microsurgery, don't drink coffee, don't go for a run, don't do this, don't do that. And then someone had the good idea that if every single morning you get up and go for a run, then go for a run. If every single morning you do this. So you don't want to change anything, because in changing things, you can actually upset things and it may not be permanent. And for the record, if I wouldn't drink coffee, I was going to do microsurgery, which I don't do anymore these days. But normal supplementations, I don't have an issue with. We do like you to stop all non-essential medicines about a week before surgery. And the reason for that is, when any medication is taken in very high doses, it can have adverse effects. And for example, some vitamins can make you bleed, some vitamins can make you clot. The safest, simplest thing is just a week or so before surgery, just stop taking them. And as far as I'm concerned, you can start taking them the morning after surgery. In fact, for all of our patients, we provide a rapid recovery pack, and it includes multivitamins, it includes protein powder, it includes some friendly bacteria so you don't get through. So we actually provide, including give you absolutely everything you need, even bras, even binders, all included. Just means we do things properly. So at least in theory, you don't have to do anything. Just decide if you want us to look after you. And if you do, we look after you. Hello, Rachel. Now from Trish. Anonymous question. After surgery, I think it's a good time to try and lose a couple more kilograms, but I've read that I need to eat more after surgery so my body can heal, especially protein. Look, I think that's a good question. I think in Western society, most of us don't suffer from a calorie deficiency. So I think the main points are to eat normally, eat healthily. And when I was a kid, we used to have probably 1 or 2 or 3 meat meals a day, because that was what was normal. If it wasn't meat, what's for tea, what's for dinner? But nowadays, we all know that we should have balanced meals. We all know should be eating more natural, less processed food. A little bit of red meat, unless you've got an objection to it, is good. It provides a good source of iron, veggies, leafy things. So just eat normally, don't eat excessively. And we all know that we shouldn't be eating too much carbohydrate, too much sugar. Alcohol in moderation, everything in moderation, good, balanced, sensible diets. But again, don't starve yourself, because you do need that protein. And again, we can guide and direct you each step of the way for that. So it's a good question. Okay, now I'll keep going down the questions here. If I don't answer them, you can always come and you can give me a ring or pop in, because sometimes the questions can be a little bit, I might not be each answering them as you expect. Okay, how long after a tummy tuck can I expect to be out and about? I have family commitments and I'm trying to work around them. It depends on how the tummy tuck is done. If a tummy tuck is done properly, you won't be out of bed that night. If you go to a surgeon who says, yep, no worries, you'll go home that day, either they're not going to do a full tummy tuck, or they just operate in their day surgery because they don't have access to a hospital, or they don't do many of them, or for whatever reason. To do a tummy tuck properly, it is a very substantial surgery. It's a lot of removal, it's a lot of repair, I perform a lot of liposuction, but you get a lot of result. And just as a small anecdote, I had one person who actually said, oh, I had a tummy tuck with Craig and I was miserable. Well, actually, I don't think she was. When I saw her that night, she was quite comfortable. But if you do things properly, it will take you a bit of time. We have superb anaesthetists, and at the time of surgery, I put a lot of local anaesthetic in. So we try and get you to wake up with not a lot of pain, hopefully minimal or no pain, and get you to a good start. But you will need a few days. So generally, I like 2 nights in hospital. If it's a small tummy and you've got good support at home, it might be 1. If it's a tummy down to your knees and you've lost 90 kilos, and I've done those surgeries, you might need a week in hospital, so it varies. But for the first week or so, you'll need to take it quietly. Driving after any surgical procedure is really more dictated by sort of common sense and the law and road traffic safety as opposed to surgery. So from a purely medical point of view, most people drive home the next day, but we say don't drive for a few days because you need to relax. Remember, most people who come to see me have been waiting for surgery for 10, 20, 30, 40, 50 years. You don't have to do the Boston Marathon and set the world on fire the next day. Just take it nice and quietly. And again, everybody's different, every individual's different, every surgery is different. We'll guide and direct you on all of those things. Okay, next question. How would a surgeon work out when an abdominoplasty is cosmetic or reconstructive? The Medicare keep changing the rules on us, but essentially there are a number of fairly strict criteria. If you have an apron, as in the skin overhangs, if you have a rash, if your weight has been stable, they're 3 criteria by which you should satisfy an abdominoplasty. Now, with all of these things, we are strictly by the book, so we will tell you straight down the line. And I think it's sad but true to say some people blur the lines and they push things through when they shouldn't. But the reality is everything these days is digital, everything is audited, everything is checked. We do everything totally straight. Because when you think about it, if a surgeon's going to sort of not do things straight there, where else are they going to take shortcuts? So we can tell you pretty accurately whether we think it's cosmetic or whether it's functional and take it from there. Sometimes there's a little bit of ambiguity, and occasionally if we really don't know, we can actually make inquiries and send in. Unfortunately, Medicare are not that helpful, but we do try and find out those things. But again, as with preparation, we make sure that before surgery you are as well informed about your options and the likelihood of item numbers and so on as possible. Trish, question, how long after surgery till I can have alcohol? I think if you're asking me, I'd wait till, well, actually I don't drink obviously when I'm operating. You could actually, in theory, have a small glass of wine the day after surgery. You do have a lot of drugs on board, but most of the drugs actually don't interact with alcohol. So if you want to have a glass of wine within a day or two, and it's a single glass, unless there's a specific drug or specific reason, I actually don't have a problem. What I believe philosophically is the sooner you get back to normal, the sooner you get back to normal. So gentle, normal things is fine, but just take it quietly. So, the day after surgery, whatever surgery I've done, doesn't matter what it is, I expect you to get up, walk around. If it's with a tummy tuck, it's like a little old lady, but you can have a shower, you can wash it, you can wash your hair, you can put your hands on your head. Gentle, common sense, normal things are fine. Now, I have more questions down here. Sorry, I didn't actually fully answer. The family commitments after a tummy tuck, you will need a bit of help with your family. So the thing about mums is they've always put everyone else ahead of themselves. Sometimes they actually need to put themselves ahead. And I do like the example that when you're on an aeroplane, if the oxygen masks come down, the first person to put it on is yourself so you can then help other people. So in this case, if a mum finally decides they want to look after themselves and make the best of themselves, they will actually need a bit of help from their family, and they can just need to relax, because if you relax, if you're well looked after, if you're happy and you're not stressed, you're going to heal better. Just common sense. And in terms of going back to work, which is the biggest questions I get asked is, if I've got a baby, when can I lift it up? And again, it doesn't matter what surgery, you can do it the next day. There's no problems. Just be careful, be gentle, because you're going to do it anyway. So just be careful, and we can guide you what you can and can't do. Going back to the gym, tummy tuck. In fact, all surgeries, you can do a little bit of light, gentle walking, lower body within a week or two, gym in a month. But for a tummy, if it's done properly, you really need probably 10 to 12 weeks before you do heavy sort of sit-ups and body and heavy bench presses and things, because repairing the muscle, if you stretch it, it's not dangerous, but you can undo the good work. So it really depends. And the thing is, with all these questions, remember, every single person is different, every surgery is different, every outcome is different. So it depends on things. And that's why we individualise, that's why we see lots of you, that's why you're always welcome. That's why after the first consult, all visits are included. We don't charge for any of them. It means you can come back. It's just good medicine, if nothing else. Okay, I've been asked, how do you know if you need a fleur-de-lis? Now, interestingly, it's actually pronounced fleur-de-lis, but I think fleur-de-lis sounds sort of a bit more romantic, so I'm going to still call it fleur-de-lis, although technically it is fleur-de-lis. Fleur-de-lis is where, in addition to a big horizontal ellipse that's removed, a vertical triangle is taken. I very much, unless absolutely necessary, try and avoid a fleur-de-lis, because what happens, you get a big vertical scar that extends all the way up, sometimes right up to your zippy sternum, which is the bottom of your chest. So what it means, you'll never wear bikinis, never wear bathers, whereas a horizontal scar, and we place it really low as possible, you should be able to hide it with a reasonable pair of bathers or bikinis. If you've got a lot of excess vertically, as in between the breasts and in the lower part of the tummy, then a horizontal excision will correct. If there's a lot of sort of horizontal excision, so there's a big circle of tissue, then a fleur-de-lis. But I do a lot of tummy tucks. I mean, this was when my first week back, which is a very, very busy week, which we do deliberately. I actually did 9 tummy tucks, which is a lot. I don't usually do that many. And I didn't do a single fleur-de-lis. So I'd probably do a fleur-de-lis in less than 1 or 2%. But again, it's individual and it's personal. Now, where's the question gone? Total body lift, again, very, very selectively. It is an appropriate procedure in massive weight loss, but it's got to be done very, very, very carefully. It's a lot of surgery. It's between 4 and 6 and 8 hours. It's got a high rate of complications. It gives a lot of scarring. So generally, I would recommend we address the main concern, which is usually the front, the tummy tuck, and we can go back and do the back later. Now again, I do breasts. I do all kinds of breasts. I do tummies. In terms of body lifts, we have body lift specialists, and I would refer you to one of those because you really need, for that, you need to go to a specialist. If you ever go to a surgeon who does an occasional anything, or I specialise in the following 50 things, that wouldn't be the surgeon I'd refer my family to. Katrina, fleur-de-lis, full body lift or tummy tuck. So again, it depends on an individual basis, but if you look at my figures, the number of actual total body lifts I refer to my colleagues would be of a few percent, and fleur-de-lis, I probably do one not very often, so it'd be less than 1 or 2%. How long after weight loss surgery do you recommend people should wait before having tummy tuck and breast surgery? Cherie, look, it's a great question. It varies from person to person. The most important things are that you are stable, both physically and I guess psychologically. So if your weight goes off and we do surgery and the weight comes back on, it's not dangerous, but you just wouldn't get a good result and good benefit. So you need to be stable. And also from a metabolic point of view, you need to be stable. Otherwise, there's increased risk of wound breakdowns, infections, and other complications. So we really like your weight to be stable for a minimum of 3 months, probably about 6 months. But we don't rush anyone for surgery. We take a lot of time, and to make a good decision takes time. So once your weight's stable, and it may never be completely stable, there's a lot of time before it's even done. But stability is more important than time per se. But as a rough rule of thumb, a minimum of 3 to 6 months would be probably a reasonable guideline. It says wave here. I'm not quite sure what that means. I do struggle with social media. I apologise. Reasonable surgeon, but social media I still struggle with. There are people who are better at social media than surgery. If having a breast augmentation, how long should you wait before going home if you live 4 to 5 hours away or the surgery took place? I keep pretty much all my patients in hospital overnight. Not all, but pretty much all. And look, bluntly, it's a little bit more expensive, but bluntly, it's one of the more important decisions you're ever going to make in your life. So it just means that in the morning, you're stable, we can keep an eye on you, we can look at you, and if you're safe and stable to go home, you can go home. Most people go home the next morning. Very occasionally they stay on, but not very usually. If it's 4 to 5 hours, whether flying or driving, worst case scenario, you could always come back. But if you want to spend time with family or friends or a local place, but most people the next day after breast augmentation, they should be free to go home the next day. And very, very occasionally even go home that night. Okay, and Sue says we need to tell everyone we provide a full package and everything is included. That is actually true. We do provide everything. We provide the garments, the bras. We've got a Fraxels, $150,000 laser, at least it was when I bought it, and that's all included. We do scar revisions. If anything's not right for whatever reason, we fix it. I don't charge for that. So we do provide absolutely everything. Because, I mean, to put it bluntly, some people go cheap, they go elsewhere, but then they don't realise that, well, then they've got to pay for reviews, or they don't get reviews. They see the surgeon who flies out or disappears and they never see them again. We see people a lot. It's just good for patients, it's good for the surgeons, just good medicine. So we do all of those things. Sherry, I hope I answered your question. Okay, Sue, okay, I bruise easily. Is there anything I'm going to do to help? Bruising varies from person to person. If it's actually severe bruising, as evidenced by like a severe bruise or blood in the urine or blood noses, and you could potentially have a bleeding disorder, I might send you off to a haematologist before surgery to make sure that there's no bleeding problem. So part of being a massive part of being a surgeon is being a doctor, and part of being a doctor is assessing a person holistically. So we look at your medical history, we assess where you live, what you want. There's a lot of things that go into it. So every first consult with us is at least an hour and a half. There's a half an hour with one of my patient liaison. They do your paperwork, they check everything. for the record, we have a very, very good coffee machine. We make fantastic coffee. That's not unimportant. We make you feel good and feel comfortable. And then I go through absolutely everything. I assess you. I photograph everything. I measure everything. I write down everything. I often go through 5 pages of checklists. And then you go back to patient liaison. They might do their computer simulation. We've got the vector. We've got all technologies. So it's a minimum of an hour and a half. And if you need to come back, that's all included too. So there's a lot of time. I know that was a segue from how that I bruise easily, but good results take time. You know, if you go to someone who Skypes you from, say, for example, Sydney, not that I've got anything against third world countries, and you speak to them for 5 minutes, that's not optimal care. You need to talk to the actual surgeon who's going to actually look after you. So it takes time. And there are good surgeons in Sydney too, so I'm not being overly critical. Do you have a maximum BMI you would be comfortable to do a tummy tuck, breast lift and arm lift on? I doubt I'll ever get under 90. I actually don't ignore BMI. In fact, we've got a BMI machine, which the girls here say all fibs and overstates. But BMI is not unimportant, but it's not the most important thing, because I think with BMI you can be heavy boned or muscular, or you might just be a larger person. So if someone was morbidly obese, then surgery might not be the best option for them. But conversely, sometimes people can't exercise or lose weight because they have very large breasts and are painful, uncomfortable, embarrassing, or their tummy hangs down. So sometimes a tummy tuck or breast reduction can actually be a push in the right direction, and people can then go on to lose 10, 20, 30 kilos. So it depends. It's on a case by case. But BMI, as I say, we do measure it. We measure and check and record everything, but I don't stress it. It's just one of many factors. And that's the whole point about treating you like an individual. Katrina, is it best to exercise and firm your tummy muscles for a better result? Look, I think exercise is always good for you. It's good for your brain. It's good for your hips. It's good for everything. But you can never repair your muscles if they've been stretched from your beautiful babies, because they're not in the right position. So good toning is good. Once we've repaired the muscles, it's actually more effective. So good, healthy, don't do anything extreme, because the problem is if you go and do something extreme, you're just going to get an injury. And as I also tell people, even in losing weight, there's no point going on the every second day stick a celery diet, losing a massive amount of weight and having a miserable life. You want to be strong, fit and healthy. And the flip side of it is a common topic is fat grafting. And people often ask about fat grafting. I personally have significant reservations about fat grafting. It has a role, but I know there's one surgeon in Melbourne who gets all his patients to bulk up by eating chocolate and milk and junk food prior to their fat grafting. But the point of it is, firstly, it's unhealthy. And secondly, even if you put on 5, 10, 3, 20 kilos, what's going to happen when you eat normally and that fat disappears? So normal, healthy and sensible, still got a role, even today. From Lauren, hello. Is it possible just to have a breast lift, not implants on saggy breasts? Is the Medicare rebate for saggy breasts still available? The answer is you can have anything. You can have an implant without lift. You can have lift without implants. You can have a combination. They can be done together. They can be done staged. It really depends. If you have very droopy breasts, and there are ways we can measure and tell you, an implant by itself will give a poor aesthetic result. And again, surgeons who don't know how to do breast lifts, or even doctors who call themselves surgeons don't know how to do breast lifts, what they will often do is put a very large implant, often in front of the muscle, which will give a great short-term result. But again, if you put a bowling ball in a plastic bag and it fills a plastic bag, what's it going to look like 3, 6, 12 months later? So again, it's the right surgery, the right operation. But I do quite a number of lifts without implants. I do combinations. I do all of them. I know I'm a crack record. In fact, people these days are going to say, what's a record? But it just depends on the individual. But they are all options. Again, what is the best way to do it is for the surgeon to assess you properly. The surgeon, not the salesperson, not a Skype consult, but do it properly in person, measure you, check, feel, 3D, and give you the best advice. And is the Medicare rebate for saggy breast still available? Medicare pays for functional procedures, not cosmetic. Now, it's a huge debate because what's cosmetic and what's not? Is it not the entitlement for a normal healthy female to have normal healthy breasts? I believe it is. So if droopy breasts are causing functional problems, so again, it is by numbers, by criteria. If you have a nipple areola complex below the level of the inframammary crease, if it's causing discomfort and pain, and if you have a child between the ages of 1 and 7, yes, it is partially covered. Now, I didn't come up with the definitions, I'm just quoting them, but until they take it away, it is still covered. If you add an implant, it is not covered because then it would be considered not functional. But again, that's case by case, but not. And from Sue, breast reduction worked for me, weight loss. Now, I think that's a really good point. I mean, Sue has done all the hard work. All I did really was the surgery. But Sue, who is a fabulous person, and I'm a fan of hers as mutual, had difficulty exercising. So I think what really happened was, it was physically able to then exercise and feel good, but also with confidence and thinking, well, now I've got to look after my, I guess to a certain extent, investment. It was a win-win. So surgery will give you a push in the right direction. What you do with that direction, that is up to you. From Tessa, do you have to have private health for you to complete plastic surgery? The answer, Tessa, is actually no. Now, this is sort of getting into the realm of politics, and I believe I'm probably a pretty reasonable surgeon, but my wife says a terrible psychologist and a worse politician. But no, you don't. Sometimes it's advantageous, but really, and I'll be very careful saying this, private insurance it's not what it used to be. And I worked over 23 years ago in America, and they had the worst system in the world, really. And I love things about America, but not their private health system. And unfortunately, Australia is following that there. So I think in the future it'll probably get to the point where you save up, you get what you want. You don't pay $6,000, $8,000, $10,000 for private insurance and find you're not covered anyway. So, and for revisionary surgery, it's often not covered anyway. Look, big question. Probably need to have a sit down and coffee and discuss it, but no, absolutely not necessary. From Courtney, is there a way to get rid of that fat pouch from weight loss without getting a tummy tuck? Lost 28 kilos. Good job, Courtney. Well done. And at a great weight, but have just a fat pouch on my lower tummy and want it sorted. There is a procedure called a mini tuck. Now, to me, a mini tuck is a great marketing thing. It sounds great, have your mini tuck and then go and have coffee on High Street Armadale. But the reality is you still get most of the scar, except in select circumstances. You're not going to address the muscle. You're not going to address the upper tummy. You're not going to combine it with liposuction. You're not going to get a very good result. So with some exceptions, do things properly or don't do them. So it depends on a person-by-person basis. I very occasionally do them, but really, again, mostly do it properly or don't do it. Craig, you're a star. That's from Lauren. Lauren, you are very perceptive, and I completely agree with you. Thank you. Anyone considering surgery, Craig is amazing, changed my life. Lauren, thank you. I appreciate that. Thanks, darling. That is a lovely thing to say. I will take the compliment. Megan, do you have an opinion on breast implant illness? Do you think implants can make me sick? Megan, this is a huge topic, so I will start off by saying I don't know, which is true. No one knows. No one on the planet knows. But I have a few thoughts. I'm not sure that it is as common as it seems, and I'm not sure that it exists. And the reason I say that is because every time you put on lipstick, you're actually swallowing silicone. Every time you have blood taken or blood given or injection, you get silicone because needles are coated with silicone. Every diabetic injects themselves with a tiny bit of silicone 3, 4, 5, 8, 10 times a day. Every time you wash your hair or condition your hair, you're bathing in silicone. So I think silicone is ubiquitous, which means it's just everywhere. And I had a patient tell me that their girlfriend had breast implants and had all these problems, including fibromyalgia. Well, I probably shouldn't say this, but my father's got fibromyalgia. So I'm not saying it doesn't exist, and no one can say it doesn't exist, but I'm not sure that it does exist. And I believe sometimes you wake up in the morning and you just don't feel terrific. And I'm not sure that we can blame anything. Sometimes that just happens. Humans just don't always feel good. So again, I know I said it 10 times, but it's a really important point. I'm not sure that it exists. It hasn't been proven to exist. And the other thing is, when you think about it, implants in America alone, every year, 500,000 people have breast implants. Every year in the world, which I'm not sure what the figure is, but literally tens and tens and tens of millions of implants have been put in. There has never been a study, as far as I'm aware, ever that has proven an established link. So I'd say it'd be unlikely, but don't know. So don't think so. Christy's watching. Hey, Christy, I think I have to do the wave thing. I'm learning. Courtney, thank you. Courtney, I hope that was helpful for you. I'm sorry I have to go through these questions quickly. And from Tessa, hi. Sorry, I just tried to find where you work and how to contact you. Our group or website is plasticsurgeons.com.au. That's plasticsurgeons.com.au. Put the AU down, otherwise you'll go to some lovely person in America, I suspect. So we're in Melbourne, best city in the world, best place to live. Not that there's anything wrong with third world countries like Sydney and Adelaide. I've worked in them as well, but I do like Melbourne. And you know what? Adelaide's beautiful. Sydney's beautiful too. Tina Lade is watching. Now, Tina is the wife of probably the most prominent, one of the best plastic surgeons on the Gold Coast. So Craig and I know each other very well. So if you're in the Gold Coast, and personally I'd fly down to Melbourne, but you've got some good people up there as well. So hey, Tina. Michelle replying to Tessa. Hi Tessa, you can contact me. Oh, that's me actually. So our phone number is it's 03 8849 1400, 8849 1400. But plasticsurgeons.com.au, and you can see if you might want to come and see us. And Kayleen wants to wave, so I think that means she's coming on board. All right. Now, I think I've got a few more questions here. Where have we got to? How long do I need to wear my support bra after my breast augmentation? Well, that's easy, forever. Now, what I tell people is, if after surgery you lived in outer space where there's no gravity, you'd have the same breast in 100 years' time. If you don't want to wear a bra and you live on planet Earth, which at this stage we still are committed to, read National Geographic. Now, I know no one reads these days, but National Geographic, what happens when people don't wear bras. So you really do need to wear a good bra for the rest of your life. And the way that I put it is, in the morning, every day when you get up, you have a shower, you brush your teeth. You do that every morning. You get in the car, you put on a seatbelt, you do that every morning. You wouldn't not brush your teeth. Maybe occasionally you would not wear a seatbelt, or you would never do that. So sports bra, just put on, don't even think about it, it'll be more comfortable. And then occasionally you can wear a strapless top, bikinis, you can do whatever you want to. You don't have to wear a bra all the time, but the more you support your breast, the more they'll stay beautiful. And that's why we actually give our patients, I think, the first 4 bras, 2 comfort bras, 2 sports bras. So you don't have to wear a bra, but your breasts are going to droop. And again, many women come to me for a breast lift, and the reason they come to me for a breast lift is by definition that their breasts are starting to sag, gravity's winning, and you've now put an implant or done a lift. Gravity's going to continue to win, but it's got the implant, so you need to wear a good bra forever. So if you don't want to wear a bra, then that's okay, but you're going to need sort of further surgery earlier rather than later. How long after surgery should I sleep on my back for? There's actually, I don't know where that comes from. There's actually no reason to sleep on your back. You can actually sleep on your side, you can sleep on your tummy. You won't cause any damage, but the downside is it will be uncomfortable. So you won't cause any damage. What I like is for all my patients to sleep a little bit sitting up, because swelling is just fluid. Fluid runs downhill. If you're sitting up, your breast swelling will go down. They'll heal up a little bit quicker. But the reality is, if you're going to heal in a day or 2 or a week, in 10 years' time, it's not going to make any difference. So if it's comfortable, you can sleep however you want to. I mean, you may not be able to sleep on your tummy for a week or 2, but if it's comfortable with a couple of pillows and you prop yourself up, no problem straight away. Ollie says, Adelaide is great, thank you very much. Look, Ollie, I think Adelaide is, there's no issue with Adelaide. In fact, I did my training there, and the training was absolutely superb, so there's no issue with Adelaide. And but I think Adelaide's a lovely provincial place, great to visit. I'd still come to Melbourne if you want to get it done properly. And I just say that because maybe someone else from Adelaide is watching, but there's nothing wrong with Adelaide. The beaches are good. Sue, I still wear my crop top every night after my breast reduction. Look, I think that's good. In bed, it's not so critical to wear your bra when everything's settled, but if you want to, you can. It's not compulsory. But it's when you're standing up or if you're going to the gym or exercising, it's more important, and that's why we give you all those bras. Ollie, clearly, my apologies. Please answer my question. Would a second breast lift without it being saggy as my surgeon made them low? Clearly, I might get you to restate that question. I don't quite follow it, and I apologise if I haven't answered your question. You can always re-lift breasts. If it's done properly, it should be in the right position to start with, and it should stay there for a long time. I'm sorry, I didn't quite follow the question. I apologise. So maybe if you can redo it, I'll try and answer it. And I was only teasing about Adelaide. Adelaide's okay. All right, so what do we got up to? How long after surgery do you need to keep the tape on? Again, we provide the tape. We provide actually everything. Usually 6 to 8 weeks. Up to 6 to 8 weeks, it gives you good support, and I think it does its help. After 8 weeks, we provide the laser, we provide oils, we provide everything. I think if you keep the tape on for beyond 6 to 8 weeks, some people get a bit of sensitivity. So there's no huge advantage, and you probably get sensitive and you get a reaction to it. So 6 to 8 weeks is optimal. Some people go longer, some people go less. One of the people I saw today didn't see me over the Christmas break because they were away and they were good. So I saw them at 3 months, they had the tape on, they were fine. So it varies from person to person. Now, if the tape gets wet, well, the tape we provide is waterproof anyway, but you can replace the tape. We give you rolls of tape and just replace as necessary. But what you don't want to do is you don't want to replace the tape every day because you just irritate the skin. So if the tape is in place, you can just leave it there. But we usually recommend about a week. We replace it every week. And incoming, we can do that for you, or you can do it yourself. It's pretty easy. Yeah, clearly I'm still waiting for that question. I'm sorry if I have not helped you. I am trying. Yeah, just resend it and I'll answer it straight away if I can. Now actually, there's a good point. I just got a post from Trish, who's my theatre nurse for I think 23 years or so, and I looked after her daughter. She's got two beautiful daughters, so I've looked after both. In fact, I've looked after the whole family now. And Alex said that having ice after surgery is a huge help, and I agree. Some of the simple things really are helpful. So we, like all of our patients, put ice on for the first 24 hours, and that'll make you a lot more comfortable. We try and minimise drugs, and if we can use ice and a little bit less drugs, that's good as well. So ice is good, and I agree. Thank you, Trish. I forgot about that. That's why Trish is in theatre. She just gives me what I want even before I know it. From Quilly, could you still have a lift? Sorry if they are low but not saggy. Might come and see you. Not happy at all with my job. They are near to my waist. Well, hopefully I didn't do that surgery. I don't think I did. Yeah, certainly. If they're low, they can be. Again, it depends on what low means. If you have the nipple pointing downwards, that's called ptosis or droopiness. But you can have what's called glandular ptosis, where the nipple is at the right height, but the breast itself has fallen down below. And that actually particularly occurs after the old anchor pattern breast reduction, which is a separate topic, which I haven't done for about 15 years because it's got problems, including scarring. But we can tighten that up. But what you don't want to do is have the nipple too high, because if the nipple's too high, it looks terrible and it pokes out above your bra. So clearly come and see me, and if I can help you, I will. If I can't, I'll also tell you. From Steph, I get sensitive a week in, it's annoying. Look, as a surgeon, I'm considered to be very sensitive. No, I'm being a bit tongue-in-cheek. Surgeons are not really chosen to be sensitive, but I agree, sensitive. There are things we can do about sensitivity. There are desensitisation exercises, oils and things like that. It depends exactly what the cause of the sensitivity. It could be a reaction to the sutures, which will dissolve with time. It could be a reaction to the tape. It could be the drugs. It could be a whole lot of things. So, Steph, if you give me a little bit more detail, I might actually be able to give you some advice or help. Now, what are we up to? I'm really scared of having obvious scars. Look, I think that's the whole point. And as I say, any surgeon who could do scarless surgery would probably have a Nobel Prize. Now, it's interesting that a lot of doctors who are not surgeons but call themselves cosmetic surgeons, they claim to have scarless surgery. Well, I've probably done about someone around about the 100 million surgeries, not quite, and I can't do surgery without scars. As far as I'm aware, it's not humanly possible. So you will get scars, but what a good surgeon will do is by very careful attention to detail, gentle handling of tissues, very dissolving stitches, tape support, oils, laser, scarring, then the scars should hopefully be minimal. And again, that's part of being a plastic surgeon. All of our training is to do with scar management. Now, the second bit of that question, and these are good questions, I've heard some scar creams can be used straight after surgery, but what if you're taped up? Great question. You can't use scar cream and tape because the tape won't stick. So what we've worked out after having done a lot of surgeries is that we tape for the first 6 to 8 weeks. After that, actually, I give you everything. Just means you do it. So we actually give you either coconut oil or vitamin E, just simple basic things. We instruct you how to massage it. So after 8 weeks, you can massage. Vaseline is the only concern. It is a petroleum-based product, which can cause sensitivity. So we do like the more organic bases. There's nothing wrong with Vaseline. It is a bit, it does stay longer, but I think there are better alternatives, and we've got sort of more gentle things. So if you've got a particular reason, no problems, but I would not recommend Vaseline. Although it does have a role in some other things. What do you recommend to your patients? We have a whole protocol of scar management, and it's really just it's just not a 3-word answer, but we provide supplementation, we provide recovery packs, we provide the tape, we provide the oils, we provide the laser. We actually got dermal therapists who do dermal penning. There's a whole lot of things, and sometimes if the scars are bad, we might even inject them with Kenacort. What are we up to from Guy? Hi, me, Dr. Rubinstein. I've recently had a LBL 2.5 weeks post-op and have some purplish bruising towards my left hip, which is quite firm. I only have slight swelling on the right side. How do I know? I guess one thing is go back to your surgeon. I don't understand why. I mean, I'm happy to take questions, but as a surgeon, if you've got a problem, you go back to your surgeon. I mean, whether I like it or not, my phone's on pretty close to 24 hours a day, 7 days a week, except if I'm operating or consulting. So you really need to go back to your surgeon. Now, if your surgeon's flown in, flown out, then there's not a lot you can do about it. And if your surgeon's not around, but really you go back to your surgeon. But in answer to your question, it sounds like you might have what's called a hematoma, which is just bleeding. Hematomas is, by a good surgeon, you can generally diagnose by having a look and a feel, but the definitive is often an ultrasound. An ultrasound will tell you if there's a hematoma, as in bleeding, what the volume is, and they can either drain it or it can be instructed to drain. Sometimes if I have someone who's got some swelling, I might put a little needle into it. And look, every surgeon gets hematomas, me included. But a surgeon should be able to tell if there's a hematoma. So I think that's probably what you've got, because bruising at 2.5 weeks should have resolved. And there's Michelle said they can call here, which is true, and hopefully, and appointments, yep, we can do them. From Steph, hey Steph, I require a bra line lift or upper back lift. I've had implants. Will it impact the implants at all? Again, I don't do back lifts, so I try not to comment on things I don't do. We do have surgeons who do it, but I would think it'd be nowhere near your breast implants. So I would say it'd be highly unlikely to have anything to do with your implants. So I'd say probably fairly confidently, with qualification I don't do them, no. From Vesna, are you familiar with rhinoplasty? I am very familiar with rhinoplasty. That was one of the things that I was trained in, but I'm not a specialist in it. We have people who just do rhinoplasties or do lots of rhinoplasties. We have 2-3 surgeons who do them. I used to love doing rhinoplasties, but I concluded probably 15, 20 years ago that rhinoplasty was not my passion. I probably wasn't the best person to do them. There were surgeons who did a lot more who are a lot better. So if you're interested, ring the rooms and we can refer you to one of our appropriate people. But rhinoplasty, like all things, potentially a terrific procedure if it's done properly for the right reasons, right person, right surgeon. From Vesna, I've had rhinoplasty 4 months ago, but unfortunately the cast damaged the bridge of my nose. I have depth and it looks like it's collapsed. That doesn't sound good, Vesna. I guess probably depends on where you are. We do have surgeons who do secondary rhinoplasties, as in fix-up surgeries, but you probably want to go back to your original surgeon. It doesn't sound good though, so I hope it works out for you. From Gay or Guy, I hope I'm pronouncing it correctly. It says, thank you. That's my pleasure. I hope I have helped you. From Vesna, how long would I wait for revision rhinoplasty in case I mind where there is obvious damage? Again, all surgeons like things to be stable. So what I would generally say for most of my patients, I say, look, let's wait 6 to 12 months. But I have patients who sometimes when they come back, I go, you know what, I need to do a correction straight away. What you don't want to do is rush in and do surgery. And I'll give you a small example. When I was a medical student, I had a little MG. It was a little sports car, and I had 3 jobs. I used to work overnight. I used to drive ambulances. I used to work in casualty. I was a footy medic, a whole lot of things. And everything I went into that little MG. It was not a very good car, but I loved it at the time. And I'd take it to a mechanic who might not have been a specialist, and he didn't do a good job. So I'd take it to another person. He wouldn't do a good job. So I'd take it back to another mechanic and he wouldn't do a good job. And I take it back to the first person and said, well, it's not my problem. Second person says, not my problem. So I guess what I'm saying in a long-winded way is take time, let it settle, go back to your original surgeon, trust your instincts, maybe get second and third opinions, but don't rush to do things because big mistakes are made in a big hurry. Best time to get things right is the first time. Best way to get things right the first time. Right person, right surgery, right surgeon, right time, right reasons. And you'll notice I'm full of cliches, which is true. It says Sammy is on, bring them on camera. Okay, I've just added you. Okie dokie. Sammy, I hope that was helpful. And so look, Vesna, rhinoplasty question, I'm probably not the best person to ask. If you want to talk to me about breasts or tummies, you can settle in for the winter. I'll talk for hours, but I'm not, that's not my field. And I do like to talk about what I do. From Sue, is there a limit to how many surgeries you can have in a year? Well, look, theoretically, the answer is no. But as you know, for most of my patients, what I like to do is address what their primary concern is, whatever that happens to be, and fix that and get a potentially, hopefully, great result, at which time they can then think about whether they need anything further. I do a lot of combination surgeries, having said that. And the good thing about breast surgery and tummy surgery is it's complementary. So having nicer breasts can de-emphasise a tummy, flatter tummy can emphasise breasts. So yes, I do the procedures together. So it's not so much a number per se, because theoretically you could have a surgery every day or week for a year, but obviously you want to keep it down because the body does need to recover. and all my patients need to recover. They need to recover physically, psychologically, and although I know they love seeing me, my sense of humour probably wears thin even on me after a while. And that's the lovely Lainey. Hey Lainey, how are you? All right, we love all our people who work here, and well, I won't say especially Lainey because that would be favouritism, but we are very fond of Lainey. And I have from Angie, I've recently lost 80 kilograms and need a breast reduction, tummy tuck, and my arms and legs fixed. I'm really nervous because I went for a brain surgery 2 years ago. The surgeon made a mistake and pushed a coil. And well, Angie, I can understand. I'm sorry if I've embarrassed you by reading it out, but obviously once bitten, twice shy. I think with all things, you want to go and see a surgeon who is going to slow things down, who's sympathetic, who'll take their time, won't rush, and can give you information with which you feel comfortable. Now, if you've lost 80 kilos, and I've looked after people who've lost that much weight, then I can say without even having seen you, then I would not be doing 4 surgeries at once because it's just too much surgery, and safety is even more important than your happiness. So what we do is work out your 1 or 2 biggest priorities, address 1 or 2. And again, arms and thighs, I actually don't do. I used to do all of these things, but I really try and super specialise because I think that's the best way to give the best service to my patients. I can refer you to one of my colleagues and that's what they do. But breast tummies, no problems. Arms and thighs, there are people who are better than me. From Jenny, tummy tuck had ETT only 7 weeks ago. Extended tummy tuck. Still have a lot of skin near belly button higher. When would I look into revision? Actually, it's probably if you've got loose skin. I'm not sure that's a good sign. Usually after surgery, everything is tight rather than loose. But again, it depends on what you had to start with. 7 weeks is too early. For most people, for most surgery, including mine, and when I see a lot of other people's surgery, and keep in mind too, I see a lot of other people's surgery and we do a lot of revisions, but it's probably a two-way street. I mean, people probably see my patients as well. I mean, I'd hope my patients always come back and see me because if I haven't done it right, I'll fix it. But it is a two-way street. So we've got to be very careful because all of us try and do our best. And as long as you go to someone who's qualified, experienced, and they're honest and you trust them, then they're most likely to do a good result as long as they're experienced and they're doing the right surgery, right reasons. From Lainey, apron cut off. Lainey, there are a lot of options. What I'd need to do is I'd need to see you, and because I'm not very good at 2D photos, I need a 3D person, same to do with humans, and then I can give you the best, hopefully, advice for you. And Barbara replying to Lainey, yep. And look, it sounds like with your weight, you might want to come down a little bit. I don't have a problem dealing with people who are overweight, but if you can be stable, it's probably safer. I can probably do more, so it is a good idea, and it varies from person to person. From Angie, thank you. Angie, I hope that was helpful for you. From Letitia, hi Craig. Hi Letitia. And from Lainey, I lost 48 kilos, down to 63. Look, I think people who can do that amount are fantastic. I think it's a really terrific effort. And as I tell people, and I'm not in any way trying to pretend to be humble or anything, I think losing the weight's the hard work. Doing the surgery, as long as it's done carefully and properly, it's sort of not easy, but it's probably the easy part of the two. And again, even with a tummy tuck, I don't give people good or great results. Well, hopefully I give them good results. But what I do is I turn them around, I push them in the right direction, I give them a second chance. Now, when I push you in that direction, in other words, tone up, lose weight, be healthy, what you do with that direction is that's up to you. And I'll quickly tell you, I do have a patient at the moment who's not very happy with me. And this is sort of true, I'll exaggerate a bit. She said she's not happy, and I said, I agree. She said, I didn't get a good result. And I said, I agree with that too. But then I said to her, but I'll also point out every time you ever come and see me, you're either eating McDonald's, drinking Coke, or eating lollies. So it's sort of pretty hard for me to give you what you want. She said, well, to be blunt, I've spent all this money. And I said, I agree with that too. And I don't disagree with that. You could spend $1 million on gym equipment. If you don't use it, it's not going to help. So we can only work as a team. There's only so much that we can do. There's only so much I can do. There's so much you can do. So I can address what's on the outside. You can address what's on the inside. And between the two of us, do more. And Lainey, 68. Letitia, I was 156. Gastric bypass, 90. I've had a body lift. Good job. Good call. Angie, have you heard of Dr. Gavin Sandico? I have an appointment with him next month. No, I don't actually. It rings a bell. I can't say anything good or bad, but again, look, do your homework. Make sure that he's a proper plastic surgeon. Make sure he doesn't fly in and fly out and he's plastic surgeon to the stars and sort of disappears all over the place. Make sure he's been in the same place for a long time. I've been doing this for 23 years, and so just make sure that there's continuity. Make sure you can talk to people he's looked after before. So again, I can't say anything good or bad about him. I haven't heard of him, but I don't know everybody. From Vesna, thank you. Vesna, again, hopefully that helped. Letitia, still need loose skin removed, so we'll be seeing you soon. Well, Letitia, I hope I can help you, but I'll tell you what I can and what I can't do. From Barbara, I have a very large hernia and a huge fupa. I don't know what a fupa is, but it doesn't sound like it's a good thing to have a huge one of. And an apron. So upper, sorry, Barbara, I'm not sure. But what a tummy tuck will do, it'll address as much as possible. So it's a combination of surgical excision, repairing the muscles, liposuction, and sometimes with very big tummies, I say, look, I can't fix you in one shot. But what we can do is what's appropriate, what's safe, and we can always go back and do more. And I personally don't charge if I have to do more surgery because I think it's just me completing the job. And I want to go to the gym because all I hear is slapping. Yeah, well, and that's the problem. You get into a vicious cycle where you have a big tum, you're embarrassed, it can not be pleasant, you lose your confidence. So if we can turn you around and give you a push in the right direction, that is the aim of plastic surgery. And Sue says you can't go wrong with Craig, he's the best. So I actually personally think you are completely very insightful and correct, but I will point out Sue is a huge fan and all I do I'm going to say love, but that might not be appropriate. I'm very, very fond of Sue, she's biased. So anything she says, take with a grain of salt, but I do take the compliment. Letitia, I'm a cosmetic nurse, RN with my own business. Craig has the best reputation among nursing clients. He is so highly regarded. Letitia, darling, if I'm not paying you, I should be. So thank you. I take the compliment. But that's a nice thing to say. And you know what? The reality is we don't get it right for everybody and we don't make everyone happy. But we try and do what we can. You're never going to make everybody happy, but if you do the right thing, it comes back. If you do the wrong thing, it comes back. Fupa, fat upper pussy area. Well, I must admit I wouldn't have guessed that, but yeah, that's addressable. And I think it's fair to say that most people who've got very, very big tummies often have, I'm going to use that now, if that's okay. I hope it hasn't been patented or anything. Patented? Yep, copyrighted, fupa. So a large part of the surgery from a tummy tuck is actually doing that reduction. I'd call it a Mons reduction. So MR, Mr. sounds better than FUPA, but I like FUPA actually. So it's a lot of liposuction and cutting out some of that tissue. So, I mean, some people say one of the best things about it, the tummy tuck, is actually getting rid of that. The other thing is too, and it's a little bit of a plug, but we've also got a laser called the Mona Lisa, and that goes where the sun doesn't shine. In other words, somewhere around the FUPA area, it goes inside and actually tightens things up. And that works extremely well. So sometimes we actually even provide that for you because that can help both on the outside and the inside. So tummy tuck does a lot of things. It gets rid of that weight. It gives you a push in the right direction. It can be obviously healthier for you. But it also, in elevating the depressed mons is a great expression. It means the fupa's facing south. It pulls it up, which can actually help with things that we're probably not supposed to talk about on forums, but it also gives you confidence. It can make things tighter, and it can even help incontinence. Fupa is a word they use on botched. Fair enough. Well, I should probably watch it at some stage. I guess I see enough of them when they come from Thailand, but I was not aware of that. But I learn things too, and the best thing about trying to teach people is you learn things. All right, now I have question 7. Do you have payment plans? The reality, or the answer is, it's illegal for us to provide payment plans. It's illegal for us to discuss financing. Now, whether that's good or bad or not, it is probably a response to people who perhaps might not have been entirely responsible, getting people to do surgery that was outside their budget. Look, unfortunately, we do everything by the rules. There are options for you, but we're not really allowed to discuss them, which sort of is ridiculous, because the thing is, you can go to Thailand and they can talk about all sorts of stuff. And really, this is my big chance. I've been trying all evening. I just want to show you a picture, and this really, really is not good. So if anyone doesn't like not good surgery, but this is a picture of a patient who I saw who went to Thailand. So can I hold that up? I'm probably not meant to do this. But anyway, that's a patient who went to Thailand. So can you see that? Now that is a healthy, pretty, attractive, sensible young person. Well, sensible, went to Thailand, got seduced by the, pay for surgery, get a free holiday, and she had that result. Now, I looked after her. We had to tidy that up. She now has breasts that she'll probably never take her top off to show a male. She'll probably never wear bikinis. She'll never wear a low, a midriff or bikini, anything like that. And that's because it wasn't done properly. And this really, really upsets all good surgeons, is when you go cheap, they have to be compromising. They have to be. Because to do things properly in Australia, we are an expensive place to live, but we do things properly and we do things carefully. We live in the best country in the world. And I've worked overseas. I've worked in Britain. I've worked in America. I've worked in Sydney. No, I haven't. I did my exams in Sydney. I've worked in Adelaide. I did my training there. I've worked in Canberra. I've worked in a lot of places. Australia has the best medical system in the world. Melbourne, I'm biased. I'm being a bit tongue-in-cheek. Every state is a good state. Melbourne is the best place to live in the world. There's nothing better. And, enough Melbourne people have gone to Queensland and Sydney and Adelaide that they've now got our cultures and things. So, there are good surgeons there as well. But why would you go to a third world country when you've got fantastic surgeons? You've got fantastic surgeons on the Gold Coast. And, Craig and I, we work together. I know Craig, there's no issue. You can go to Nick Moncrief. You can go there are different places. So, the whole go cheap, don't worry about it. We can always be fixed up. It can't always be fixed up. All right. And I've just been told I love Sydney. I love Sydney. In fact, I do. We always have. It's a terrific place to visit. No issues. Last question, because I'm being told by Rachel to roll it up. I think I talk too much. I'm booked in with Craig in 5 weeks for abdo after massive weight loss in 6-month period. Is it going to make a difference after surgery by strengthening my core muscles now? I've been working in the gym. Actually, I think we've actually already covered that. So gym is good. Don't overdo it. Just do what you feel good about, and you can do all of those things. And someone has just put the point, no aftercare if you go overseas. Don't do it. That's the point. If you go to Thailand, and I've got nothing against Thailand, it's a great place to visit. I've already used that line. But you wouldn't drink the water there. Why would you have surgery there? And if you have a problem, you have no comeback. You can go to Thailand and get good surgery, no question. You can come to me and get not good surgery, no question. But the reality is that much less likely. And if we don't get things right, we're here. We are legally, morally, ethically responsible for you, and we can look after you. You go to Thailand, and I'm not being mean or anything, but people who go to Thailand, we say, if you want to go to Thailand, go back to Thailand. If you go to somewhere, it's like you buy something on the internet, it's not what you expect. So you bought it on Etsy and it looks like it's 6 feet wide and it comes to be 3 inches high, and you take it to a shop to get it fixed. It's not going to happen. And the other thing is, you go to Thailand or places like, they're often not cheaper in the end when you take into account all the things that you need. And, this person who I showed you that photograph, she had 8 months of remedial management to get back to never get back. So that's 8 months of her life she'll never get back. So you're going to save a few thousand for that. Now, I don't like talking money, but why would you go overseas? Okay, now I think I've probably talked enough. If I am too much later, I won't get dinner at all at home. Mind you, if I got home early, I'd surprise my wife. She wouldn't know who I was. So I hope that has been helpful. The whole point of the exercise today is really to educate people so they do things properly. Now, whether you come to Cosmetic Surgery for Women, whether you come to plasticsurgeons.com.au, which is us, whether you go to another surgeon, it doesn't matter. We'd obviously love you to come here, but whoever you see, make sure that they're a good surgeon, that they're qualified. They don't fly around the country. They've been doing it for a long time. They haven't taken a big break to go and pursue some avenue, that they're dedicated and committed to plastic surgery, and they'll do the right thing by you. Trust your instincts, but do your homework. I hope that was helpful. Thanks for your patience, and I hope that was helpful. So make an appointment, come and see us, and we'll be straight down the line. If we can help you, we'll tell you. We'll give you hopefully good advice, and good advice is the start of a good journey. And it should be a pleasant, fun and enjoyable experience. So I'm tired. I've been consulting all day, not operating till Friday and Saturday, so I get a little bit of a break, and look forward to coming and seeing, or look forward to you coming and seeing me. All right, good night all.